Hey everyone, welcome to another deep surface healing massage video. My name is Lamar Wilkinson. I'm a clinical massage and strength recovery specialist, and today we are going to talk about why it's so hard to get lasting results when dealing with the symptoms of plantar fasciitis, right? How do we get this dysfunction to go away for good? Yeah. So, in order to understand how we get lasting results, we need to talk about a muscle that is generally overlooked when we are addressing plantar fasciitis. That muscle is called the tibialis anterior. So, what does it do, right? It assists in dorsiflexion. What is dorsiflexion? Let's talk about it. Dorsiflexion is the position your ankles are in with your toes pointed towards you. Many clients who come in complaining about symptoms of plantar fasciitis, they have an occupation, work environment, or like daily lifestyle activities that have their ankle in a dorsiflex position for long periods of time, and we'll list a few of them here. Perched foot, or like if you're in a stool with your foot perched behind you. Driving is a very big component here. We are constantly keeping tension in that tibialis anterior, having the toes just kind of at a ready position on either pedal. Squats or any kind of kneeling activity, we can see where we're shortening that angle as the knee crosses past the toe. We're going into dorsiflexion there. And then the position that your ankle is in while biking, while bringing the pedal back behind you, and also hiking when you're doing like verticality. So, why is it a major factor in plantar fasciitis? There are two reasons. The first one, when we're in the positions mentioned above, they all call for the knees to be in a flex position, which is the main job of the calves, right? Gastrocnemius. So, and that's fine. And that is where we get kind of the logic behind, well, the calves are really tight. We need to stretch the calves in order to alleviate the symptoms of PF, right? So, and that's half right. So, when the knees are flexed, we have the calf tissue behind the knee is shortening in order to close that off, in order to flex the knee. But if we're in dorsiflexion, then we have the tissue that the calf turns into, that Achilles tendon, that tissue is now lengthening, right? So we've got it short, up, proximal to the knee, close to the knee, and distal to the knee, closer to the ankle, we've got that tissue lengthening, right? So we've got conflict here, right? And that's producing that tension. That tension is coming down through the Achilles tendon, underneath the calcaneus, that heel of the foot, right? Causing that tension, that pain you feel on the back of your heel up underneath your foot. And then underneath, causing a pulling tension where the plantar fascia is located and the surrounding muscles. That constant pulling tension down through the Achilles tendon, up underneath the foot, into the up underneath the sole of the foot, where those muscles are located, and also the plantar fascia, that creates an environment of weakness and inflammation. When we are in dorsiflexion, that tibialis anterior is contracted, yeah, and it's contracted for prolonged periods of time. It gets conditioned to be that way. So it's going to resist going in the opposite direction, even though that's the direction it needs to go in order to decompress. It refuses to relax. So you at home may know what happens when you try to stretch this muscle without working into the tissue first to soften it with massage. And you know about it if you've ever been lying on your back in bed and all of a sudden you get this major cramp happening in the foot. You hop out of bed, you're like bouncing everywhere, trying to get your foot to calm down. Notice how your toes are trying to curl up, right? What has happened here? Just the weight of your blanket is trying to bring your ankle into plantar flexion, yes? The opposite of dorsiflexion. So The tibialis anterior, if it's hypercontracted, is challenged here, and not only the tib ant, but also um, its partner in crime, the extensor digitorum, which is responsible for just lifting your toes up towards you, right? So when those two together are very contracted, and that blanket weight, and your body also naturally trying to relax as you come into rest, um, it will seize once it meets a certain threshold because the tissue has not been worked, it has not been softened, and it absolutely refuses. And so the problem here isn't necessarily the plantar fascia itself, okay? It's more so the tissues that are surrounding that area. The surrounding muscle fibers are weak and overstretched to the point where, just like how the tibialis has been conditioned to be short, the Achilles tendon and the muscles underneath the foot are now conditioned to be long. If you think about a slinky, and we're constantly pulling this slinky, constantly pulling it apart, right? It loses its tone, right? It loses its ability to contract well. That's what's happening underneath your foot. So when you're driving, you're fine, right? When you have your foot perched behind you, you're fine. This over lengthened position actually feels good, right? It feels like that's relief when really it's the only thing your body is comfortable with. Because as soon as you stand up, right, the foot comes back into more of a neutral position. You know, it's not like this anymore. It's more like this. That over lengthened slinky, now you're asking it to come back. And as you know, with a slinky that's been pulled too long, when you release and you come back, it's not going to contract very well. This translates in like human tissues when you have an over lengthened muscle and you try to get it to contract or change in any way, it's going to create strain. If you try to get a muscle that's too short to try and open, right, without addressing the tissue first, it's going to create strain. So that inflammation caused by the strain is going to be felt throughout the plantar fascia and into the surrounding joints. So back to the calf. While the calf does need to be stretched, many of the traditional methods that we use to try to stretch the calf are not as effective because they ask us to begin the stretch while in dorsiflexion. And if we start the stretch while in dorsiflexion, then the tissues that are used to being lengthened are going to lengthen first. And we're not going to be able to reach that contracted muscle closer to the knee. If you've ever been told to do the stairwell uh, calf stretch, or when you have your foot up against a wall and you start in dorsiflexion and you try to lean into it, you're going to get more of a stretch closer to the Achilles tendon, and this is already over lengthened. We're marching towards dysfunction here. It may feel good, yes, but that's just your body saying, oh, thank you for not asking us to do anything that requires strength. So with clinical massage, we are able to address the contracted tibialis and the contracted calf muscles directly. If we are not considering every point of influence when we are attempting to arrest and reverse musculoskeletal dysfunction, we are simply not going to get lasting results. I've been addressing PF this way for the last 5 years, and I've never lost. I can boldly say I guarantee results. I guarantee that your frequency that you're dealing with symptoms and the severity will be reduced when I address plantar fasciitis. So if you are looking for a clinical massage therapist who does focused, goal-oriented massage based on your lifestyle, based on your biomechanics, based on your arthrokinematics, if you are tired of leaving your care team or your bodywork practitioner not understanding how you got here, and you're looking to educate yourself on what you need to do in order to stop dysfunction from happening, information's in the description. I'll see you on the table.